All right. Hello, everyone, and welcome to the Wellness Connection. I'm Dr. Mark LeMay, and today we have a special guest with us here today. This is Shelise Irby. She's a registered dietitian, and she's also an advanced morphogenic field technique practitioner, and she also is very knowledgeable in the topic that we're going to be talking about today. So welcome, Shelise.
Thank you, Dr. Mark.
So first thing I want to say is like, if you're seeing us right now, please give us a thumbs up, some kind of comment, let us know that
hearts.
You're there. Yeah, little hearts and stuff like that. And again, if you have any questions that you would like to ask us as we're going through here, please text that to us and let us know. And then again, afterwards, for the people that watch us later, give us some comments down below here too, because we'd like to hear from you there too. So
we love feedback.
Oh yeah, we love feedback. So number one is that Michelle and I and you this last weekend, we were with 250 other plus practitioners at a great seminar where we covered kind of like what I like to call the BS of METS, which is Metabolic Syndrome. So we wanted to really kind of let people know today, it's like, what is metabolic syndrome? So just to kind of start off here with Shelise, what would you say is like a definition of metabolic syndrome? Because I know a lot of our people that are watching this right now have never heard of this before. So could you kind of give them an idea of what it is?
Yeah, definitely. It's not something that most people are familiar with, even in the medical field. I feel like I learned about it in school because of the nutrition background, but metabolic syndrome is pretty much a combination of different symptoms, or lab tests that a patient might have that would show that they're on the path towards this metabolic syndrome issue. And so number one is going to be high blood pressure. Metabolic syndrome, that's one of the main factors. Next one after that is high blood sugar. Yep. Which a lot of people have.
Yeah, which is almost kind of like pre-diabetic or diabetic.
Yeah, diabetic. Number 3 is abdominal obesity. And so
if your doctor calls you fat, is that what you're saying? But you're like, hey, Shelise, you're fat. It's like, no, I'm not. Yeah. So if you got more fat here.
Yeah, if you're concerned, that
that's a great way to put it. If you're concerned about your waist.
Then we're also going to show today, we'll do a little workshopping of a simple test you can do at home to see if you might have some concerns with abdominal weight.
You're a little chubby.
A little bit of muffin top there.
Yeah.
and so that's number 3.
Okay.
That was abdominal obesity. Like if you're carrying your weight over your body more evenly, it's less of an issue. And so the abdominal obesity is really what we're looking for when it comes to metabolic syndrome. And then the last thing is cholesterol issues. So if you have high, people who are listening, if you've had your blood work done recently, then you might know what LDL or HDL cholesterols, high triglycerides mean. But if your cholesterol levels are off or your doctor has recommended a statin for you, then you know that you have cholesterol issues.
Yeah, so like high cholesterol, high blood pressure, high blood sugars. I mean, these are like things we hear about commonly all the time here. Increase, fat around the middle part of your body. Yeah. Okay? So those are like signs of possible metabolic syndrome.
If you have 3 of those, like kind of 3 out of 5, then you can be technically diagnosed with metabolic syndrome.
Okay, and most people don't go to their doctor and the doctor's, hey, you have metabolic syndrome. You just don't hear that. I mean, it's all the other things you hear, but you don't hear about this one so much. And again, the U.S. statistics right now say that 3 million Americans have this currently right now. So that's like 1 in 3 people are currently being diagnosed as having metabolic syndrome. So this is something you're going to hear a lot more of coming up, in the future here. Yeah. So, okay, so if a person, because I mean, we hear about heart disease a lot. That's one of the reasons why we do the heart sound recorder. Yes. Because we're really concerned about it. It's the number 1 killer of men and women today. So with that in mind, why, that's one of the reasons why we do like the heart sound recorder testing, but there are other diseases out there besides heart disease that are part of this whole syndrome. Or could you give them some names of some other ones that are out there that are considered part of metabolic syndrome?
Yeah, we can talk about a couple of them. There's probably number 1 would be diabetes. It's very common and it's one of the main contributors to metabolic syndrome. especially here in the U.S. because we kind of have a highly refined food diet.
Yeah. More carbohydrates.
Yeah, a lot of carbohydrates and a lot of like processed food. You know, just not, most people don't make all their food at home anymore. You know, they're eating it out and stuff like that. So definitely diabetes is going to be one of those diseases that can be in combination with metabolic syndrome. Alzheimer's disease is becoming more and more common.
Correct. And it's like, we were talking about this earlier. It's like there's type 1 diabetes, which is something where the pancreas is gone and it's not functioning. So then there's type 2, and then there's also type 3, which is what they consider to be Alzheimer's disease.
Yeah, and the functional medicine community, like the new term for Alzheimer's is kind of becoming type 3 diabetes because we know that people who have dementia and brain challenges, blood sugar really contributes to the damage that happens in the brain. And so like having a long time of high blood sugars is really going to predispose you to having memory and brain issues later
brain
in life.
Inflammation. So that's the main thing, is the brain inflammation causing that problems with memory. So, okay, so we got the diabetes. Is there any other ones too?
There's also circulation issues. Like circulation is a really big deal because it's how our body gets nutrients in and out of our body. And so things like, you know, poor hands and feet, even erectile dysfunction is a circulation issue most of the time.
That's a big issue with my male patients today. I mean, it's like when they start talking about those things, it's like I'm looking for like inflammation and how can we improve their, you know, their vasculature and their circulation.
And things that make our blood thick are, you know, the sugar in our blood. And
boy, sugar just isn't good for us at all, is it?
Keeps coming up.
Yeah.
And then the fat, you know, if we have too much fat in our blood, that makes our blood thick. And if our blood is thick, like, you know, syrup, then it can't get to all the, you know, blood vessels and all the little places that it needs to go.
And again, we also know that there's a difference between good fat and bad fats too. So that's something that we maybe have to touch on that subject
on a different video.
Different video, yeah, probably.
Yeah. So those are like the main things that average patient might be thinking about when it comes to like their concerns to metabolic syndrome. Okay,
so this sounds like this is pretty, you know, serious situation, first of all, for most people.
It can be.
And then we want to kind of like give the viewers here some things. So say, again, if you have any questions like, you know, hey, how do I know if, you know, if I got, I mean, do you guys have any questions about it? Please ask us, you know, or give us a comment down below here because we want you guys to understand this a little bit more. So we're going to try to make it as clear as we possibly can. Hopefully we won't make it as clear as mud.
No.
But we'll make it as clear as possible to identify this yourself too. So what are some of the things that they can do to identify if they have this kind of condition?
Yeah.
So,
should we do the, we show them?
Show them that first one here, which is called the waist to hip ratio. Okay, so I'm going to be the guinea pig on this one. So Shelise is going to measure me on this one here.
Dr. LeMay is our patient. So all you need to do this test is a fabric, what are these things called again? Not a ruler. Like measuring tape.
It's a measuring tape.
Yeah. And so you can't use a flat ruler for this.
No flat rulers on this one, gang. Doesn't work. Got to have something that's flexible.
So what you're going to do is you put the tape measure, it's like kind of right above the hip, but around the narrowest part of the waist. And then you're going to...
I hope this is the narrowest part of my waist.
It is, don't worry. And so we're going to see what the measurement is. It's about 35.
Okay.
And then it doesn't have to be exact. And then the second measurement is measured around the hips, which is the widest part of the hips.
This is where a big fat butt comes in handy.
Yes, because we're going to divide.
We're going to be dividing this. So
you're about 39.
Okay.
Okay, so that's like the easy part. Then you have to do some math.
Oh, here we go. Because I know this is one. Like this is kind of a nice, you know, diagram here. Now you can go. I got this by just typing in Google search for, you know, waist to hip ratio. And then you just go under images and you can pull this up. This is a great one right here. So when I did basically my waist divided by my hips, mine came out to be 0.88. That was my ratio. So 0.8 puts me in the good category for men.
Ta-da!
Ta-da! So good job, Dr. LeMay.
Yay!
Okay. So it also tells you, like, you know, what's good and excellent and what is, you know, not good over here. So you can actually check that out. But it also does a really great job of showing you how to do that calculation there too. So really super simple, easy one to do. So that's one way of checking out if you have too much
abdominal obesity
area. Okay.
Yes.
So, and then again, what are some other things that patients can do as far as like we want to kind of take a look at, like symptoms that people have, because again, that's another thing, because people are like, okay, I've checked my waist to hip ratio. What are some other symptoms people might have that can be kind of like clues that they might have the metabolic syndrome?
Yeah.
What are some things?
An underlying issue with metabolic syndrome is inflammation, right? So if you have, swollen joints or inflammation, in your hands and
like
feet.
real stiff and sore all the time, stuff like that.
A little arthritic, kind of like
they
especially
feel
if you
really
wake up
hard to close their hands.
Yep, that's a sign that there could be underlying inflammation going on. We can have, like we talked about circulation issues like cold hands and feet.
Yeah, that's a big one.
Are a common circulation issue. We also, fatigue is going to be one. If you're carrying around all that weight all the time, it's going to add to stress on your body every day. And
I know some like people have like problem with memory.
Yeah.
Like I can't remember your name now. I'm kidding. It's like, and I'm serious. I mean, everybody here out there have that problem? Let me know. Does anybody out there ever have problems like, gosh, I'm just trying.
Yes.
It's like I'm trying to remember that word. I just can't think of it. And it's like, gosh, I use it all the time, but I can't remember it. That's can be an issue if you're having metabolic syndrome, because you should be able to have good recall like that. And so that's a possible issue right there too.
One of the most common, I would say, would be like, the memory issues.
Yeah, and of course being overweight. And then another one that I see, and this is a biggie too, is like people having trouble with sleep at night. Poor sleep, not getting back to sleep, those kind of issues like that too. That seems to be another big issue for people as far as like a symptom of that.
Yeah, sleep apnea is just all my patients walking in my door being diagnosed with sleep apnea, and so that's another sign and symptom, that there might be some metabolic issues going on, especially if
the weight,
the weight on your chest, it's putting pressure on your lungs and your throat, and so
because if you have more fat in this area here, the abdominal fat like that, it's like when you're laying on your back, it's pushing down and it puts pressure on the contents of the abdomen and up into the chest area, so it's harder for them to breathe. Okay, so it's not all bad here, right? I mean, this is like, oh, you guys are all doomed. You guys are not going to be able to get away from this stuff at all. Well, it's funny because I think we looked this up when we were at the seminar as far as like what they define this as, and it's just like, this condition is not reversible, it's not curable, or
and very common, it said.
Yeah, common, but not, you can't get rid of it. And it's like, there's the BS part, gang.
Yep.
Okay? That's not true. So let's talk about what they can do to reverse this process.
Yeah, this is the exciting part.
Yes, this is.
Because that's one of the best things that we get to work on with our patients is seeing them improve and getting to like delay or eliminate these, negative stuff that we talked about that none of us want. We don't want it ourselves, and we don't want our family members to have this either. Yeah. But if 1 in 3 people have metabolic syndrome, like someone in your family probably has issues with this. Yeah. So number 1, we start off with lifestyle changes.
Exactly. So that's the big thing. So tell them, what are some of the lifestyle changes that they should be doing?
So number 1 is looking at your diet overall.
Yes, people. We have to look at our diets.
I'm a
That's
dietitian.
a toughie one right there, because it's like, no, don't take away my food.
Yes, I know. It's challenging, but it's all about what your goals are, When you're older, if you want to be able to remember your grandkids' names and you want to be able to be physically active and not have swollen joints, then this is something that you have to be thinking about now.
And it's really, I'm glad you brought that up, because again, this is one of the things that I hear from a chiropractic standpoint here is like, patients come in here and it's like, I just can't do what I used to do before. It's like I'm having a hard time doing my daily activities, like, walking my dog and, picking up my grandchildren and doing all these kind of things. And it's like, okay, if you can do that, you still can. You just have to take care of yourself. And again, that's where it comes down again to the lifestyle changes as far as diet. Diet is huge, everybody. Okay, I want you to really understand that, because what you put in your mouth becomes you. And if it's good, it's going to make a good you. If it's bad, it's going to make a bad you. Okay? And again, I can tell you that most of the stuff that you're going to buy out there today is not good.
Making a good you.
but again, there's hope. There's a lot of good food out there. You just got to know what it is. So that's good. So diet changes. What else? You said exercise.
And prevention is key when it comes to that. Like, diet changes is not something that you can do overnight.
No,
and it's not something that you can see the results of overnight either. So this is like, the earlier you start, the better. But the other thing is hydration. Looking at water intake. Majority of my patients come in, they're very dehydrated. and they're not necessarily having a bowel movement every day.
Really?
They're really constipated.
They're not pooping every day? So,
They're
what would happen if they weren't doing that, Shelise?
Well,
So if they weren't eliminating those toxins,
yeah,
they can't detox.
And you can't lose weight if you can't detox. So they're like,
I'm not even going to go there. Okay, it's just like, yeah. So again, I mean, it just makes sense. You got to be eliminating. So it's like, I know there's an old saying in nutrition. It's like, you got 3 trains in, there should be 3 trains out. And most people are like, when I tell them that, they're like, what? I'm supposed to poop 3 times a day. I have never pooped 3 times a day in my life. And it's like, we're going to change that. We're going to change that.
Shocking news. So that's really important, hydration, and making sure that digestion is working well. And other lifestyle things is physical activity, you know?
Yes.
We get told this all the time. It's not new information.
No, it's not.
But, you know, doing something physically active that's going to raise your heart rate. That's the important thing. You know, walking is not necessarily going to be enough if it's not raising your heart rate, if you're not walking up a hill or something like that, you know? So you really have to be thinking about the type of physical activity you're doing. And, you know, it doesn't have to be long. It can be like 20 minutes a day. That's pretty easy for people to fit into their schedules.
Yeah, and then what kind of things in their diet should we really be trying to get out of their diet that we know really causes problem with metabolic syndrome? So
yeah, that's a good question. And the main things that we want to be eliminating is inflammatory foods.
Yep. Right?
Inflammation is like an underlying problem when it comes to metabolic syndrome. And so if we're eliminating inflammatory foods, then we have to eliminate a lot of those carbohydrates, right? Especially
the main one.
Wheat.
Yeah, wheat's one of them.
And sugar.
You know, and again, it's like, I mean, there's different types of sugars, and we'll talk about some of those different types of sugars probably in another show about what the good ones are, but the main culprit is white sugar, high fructose corn syrup, and or just, you know, corn syrup in general. That's the worst game. You get that out of your diet.
So we have, you know, getting rid of carbs and including more healthy fruits and vegetables and high-quality proteins. And then the last one is getting rid of, like, bad fats. We want to keep good fats in our diet, but trans fats are one of the worst fats out there that really contribute to heart disease. There's so much research out there talking about how unhealthy trans fats are for us. So
trans fats are your man-made fats, okay? Because, like, I remember this is one of the things I actually learned in chemistry, which, you know, it's really funny because chemistry...
You don't learn much in that class.
That was my nemesis. I hated chemistry, but now I love chemistry, but...
Because you use it every day.
Cis molecules are, like, naturally occurring fats, and then your trans are the ones that are man-made. Those are not naturally occurring, and so that's why you want to stay from trans fats, because they're man-made. They're not normal for your body.
And the way you'd see them on a label is it'll say hydrogenated.
Yes.
That's what it'll say, like on the cookies or something like that. Hydrogenated oils.
Or else you see the little thing that said no trans fats.
Yes.
That's another way to check for it too.
But not always. Avoid all the hydrogenated things.
Yeah. And then I know we also talked to, like, Kerry Bone this weekend. He was talking about his 5-point, microcirculation.
The microcirculation diet.
Yeah, the diet is great.
You use that with your patients a lot, right?
Yes, I do. Yes. And again, it's like that's something that just helps improve your circulation overall. And, you know, actually, Michelle, which I wanted to say thank you for filming here today. She's our camera person here today. So she will be posting, she'll be posting the microcirculation protocol, you know, down below here. So you guys will get that later on. So I'll make sure that gets posted in the comment section down below.
And it's foods that you can add to your diet that help with circulation.
Yeah. And then we also kind of want to know our family history because, I mean, my family, just going to point to my family, it's like we have a high incidence of cancer in our family. So I always, you know, look for things that I can do that will help me to avoid that kind of thing. Because is genetics or epigenetics more important when it comes to, you know, like family history type stuff like that? Because people always hear about genetics. Oh, my genetics, I've got this, and I'm just doomed to get... No.
Yeah.
Because epigenetics... Can you kind of tell them a little about epigenetics and genetics in this area to kind of so they can understand? Because which is more powerful? Epigenetics or genetics when it comes to this?
In regards to your health, epigenetics is way more significant.
Okay, and then genetics. These guys, I know most of them don't know what epigenetics means. So tell them what that is.
Yeah, so your genes are actually very strongly influenced by your environment, and that's what epigenetics means. It means how your genes change in response to your environment. And that's why some people can live in really hot weather, you know, and some people can live in really cold weather. Some people, like Eskimos, can survive on, you know, like all meat and fat diet, and some people can survive on mostly vegetarian diets. Those are all things that are influenced by our environment. and are like, it's only in the single digits, the amount of genetics that are like concrete, can't change.
Yeah, 5 to 10%.
Yep, it's very small. The rest is all up to us and the choices that we make, every day.
So are you saying that we have control over our health, Shelise?
I think yes.
Oh, amazing. That kind of sounds like some of the stuff you're telling us is kind of more on that BS side.
Yes.
So
definitely.
yeah, that's really good news for everybody here. So great. Thanks for telling them about that. And then the one thing that we got this whole weekend, we talked about, okay, what are some other things we can do to enhance this process that we're going to? If we have metabolic syndrome, what can we do? And then Carrie and Lee talked about certain herbs that we could consume to also help with that process. Can you tell us a little bit more about that?
Yeah, I will definitely talk about that. But I wanted to also mention that, lifestyle changes are important. And then getting a nutritional evaluation by a practitioner that,
like
knows
somebody like Shelise
what you're
or myself.
doing. That knows what they're doing when it comes to functional medicine, functional nutrition, that can help you get to the next step. Because once you've done those lifestyle changes, you might need something else, like herbs,
That's another helpful
or
thing you
food
can do.
concentrates, to help you get to that next stage of health. And so the herbs that Lee and Carrie talked about this weekend, which were really exciting, because I actually got to try one of them.
So did I. That was really interesting.
It's called bitter melon. And
we see them at the farmer's market around here
Yeah,
all the
I
time.
know.
I was like,
They're
it looks like a melon. I mean, it looks like a
weird.
cucumber that's got like a melanoma or
Yeah,
something. Like,
it
I mean,
does.
it's really odd looking, but
It's like bumpy cucumber.
yeah, really bumpy.
And it's green, and it's actually used in a lot of Asian and Indian,
Cuisine,
food.
yeah.
And they actually use it therapeutically. Like, they don't eat it because they like it necessarily.
Because it's bitter.
Because it's very bitter. Yeah, bitter melon. But they know to use it, occasionally in order to help support their blood sugar.
Yeah.
And so the bitter melon was one of the herbs, and then the second one was black cumin.
Yeah.
And that's kind of like little black sesame seeds. That's kind of what it looks like. But it's like cumin is used in a lot of Mexican food.
Yes, it is.
And so...
Tastes good. It really does. It really is good tasting.
The tablets actually smell and taste really good.
Yeah, they do. I mean, the bitter melon, you really don't taste it in
No,
those.
you don't, because the other ingredient in there is cinnamon.
Yes.
And cinnamon, you can smell the cinnamon.
Just put the tablet up here, you can smell. It's like, hey, this smells like cinnamon.
Yeah. And we mostly know, as an average person knows that cinnamon's really good for you, healthy for blood sugar. The thing that Carrie and Lee talked about was cinnamon quality. And so you really have to be careful about what kind of cinnamon.
Yeah, because there's like 250 plus species of cinnamon. I had no idea. And so they were talking about how you have to find, they did a lot of exhaustive research in this area.
2 years.
Yeah, to find out what was the best therapeutic cinnamon and could they get it in a bioavailable form consistently to be able to make it for this product.
Yeah, and the safest form of cinnamon to use, long term. So knowing what kind of cinnamon you're using is important. And then the last ingredient was fenugreek. Yeah, fenugreek seeds. Which
we've actually, Michelle and I, we've actually used that a long time ago for teas.
Yep.
Steeping it and using it as a tea. So
tell them
what are some of the things that
food.
fenugreek really works well for?
Fenugreek is really good for helping with detoxification, lymphatic drainage. I give it to a lot of my patients with sinus congestion and mucus and inflammation, and in general.
Here we go. Inflammation.
Yeah.
Okay. So they put all four of these into the metabolic complex. And that's something that, again, it's really very helpful for all these different conditions that people are suffering from. So it may not be for everybody, but at the same time to see a health practitioner that utilizes these kind of things in their practice to be able to see if that would benefit you.
Yeah, and like we said, I mean, there's so many steps you can take to prevent metabolic syndrome, and doing herbal nutrition therapy is one of the steps, but it's not the only step, and it can't be the only step.
No, it shouldn't be.
Nutrition doesn't work like drugs. It's going to help support your lifestyle changes as you improve overall.
Correct. Yeah. So again, there's all these different things you want to be doing to get the result. And again, it takes time too, doesn't it, Shelise? Because again, it's not like you take this and metabolic syndrome gone.
Yeah.
No, it takes time. We both of us give our patients time frames of how long it takes for these things to go. And again, if you stay the course, it's like, remember, the tortoise wins, not the hare. Okay, so it's like you got to give yourself some time there. Okay, so basically they've got a lot of things that they can do. So they have a lot of control about this metabolic syndrome as far as what they can do here. And again, this is something that we know that patients are going to really benefit from, doing these different steps. And so basically, again, let's kind of go back and kind of recap things a little bit for them. So again, number one, they want to eliminate from their diet
a lot of the refined carbs.
Refined carbs, sugars, things like that. Okay.
Wheat.
Yep, exactly.
Really high sugar fruits.
Try to reduce their stress.
Yeah, we forgot to mention that. But stress is so
a big
important.
one right there. So, because again, stress comes in three forms. So you got physical stress, you got emotional stress, and then of course you've got chemical stress. Okay, so can you give me what's an example of physical stress?
Over-exercising.
Over-exercise. So you can overdo exercise. So, okay, what would be so we got
emotional stress.
Emotional stress.
A mom with 4 kids.
Just a parent with a kid. Okay.
Yeah, right.
Okay.
Michelle's
right there.
One
and then
child.
What would be a chemical stress?
A chemical stress could be pesticides.
Pesticide could be the whole Sacramento Valley area is filled with smoke because of all those burnings and fires and stuff like that. There's another one right there too. Okay. So then, of course, we want to make sure that they're doing some type of exercise. And again, I just kind of tell my patients it's the best form of exercise is the one you'll do on a consistent basis. That's the best for you. And then, of course, they might possibly want to get evaluated. So if they're doing all those things and they're still not seeing the results they want, good idea maybe.
Or if they're just going slow and they want to go faster.
Exactly. They can do that too. So again, seeking somebody that can kind of help them through that process along with, because again, the whole food and the herbal supplements that we give to our patients is to help support that process. Okay. And then, gosh, can you think of anything else?
I think that the last thing, it would just be, looking at any other options towards your health. So we just have to look at, like you said, all the stress support and
sleep and all that kind of stuff.
All that kind of stuff. Like metabolic syndrome is kind of like this mosaic. It's like a complicated process, and so that's a good and a bad thing, because it's good in the sense that a lot of little changes that we make can make a big difference. It's bad because there's a lot of things that need help, right? But I like to look at things from the positive side. Yeah, and which
is good.
Yeah, really and I like to say that, little changes in all these different places can really make a big difference when it comes to metabolic syndrome.
Okay, so good. And then, so if you don't want to take Shelise and my opinion on this, because again, it's we're just trying to, this is where we went to this weekend. We went to the Bittersweet Paradox. And it was talking all about metabolic syndrome, and we got to talk to and see and hear, Lee Carroll and Carrie Bone talk, and then I actually picked up their little small resource book here. This is
their tiny little reference book.
Yeah, tiny. Because again, it's a great textbook of. It's a great textbook and reference for all the different things that we're doing here, because sometimes people ask me, it's well, I don't see any information on this, some studies that's all this is right here. These are all the different scientific research studies on these different herbs and what they do. So lots of great research out there talking about how these things help people with their health and get better. So, Shelise, I just want to tell you, it's great. I mean, it's been so long since we did that last video on the Heart Stop recording. It's just great to have you back in here doing this with us here on Metabolic Syndrome. So, thank you very much for being here today.
You're welcome. Thank you for having me.
Next week, gang, what we're going to be doing is next week, we're going to actually kind of continue on here. We're going to be talking about because we've got the holidays coming up here. At the end of this month is Halloween. And then, of course, we got Thanksgiving, and then right into Christmas. And so people have a lot of problems with, again, remember, sugar is one of those things that's a real problem. So next week we're going to be talking about Genema, or the Sugar Destroyer Spray, and how this can help you to regulate those sugar or carb cravings. So this is a great tool to have in your tool belt for helping with those kind of things. So I hope you enjoyed the Wellness Connection this week. And we'll try to have as many fun and exciting patients, people just like her on our show, Shelise. So then I hope you had a great time. So we'll see you next week. All right, bye, everybody.
Bye.